Hey, everybody. Welcome to the Health Babes podcast. Today we had Dr. Paul Hrkal on. He's a certified naturopathic doctor, and he has a special interest in neurological health, chronic pain, and brain injuries. He was awesome. This is one of my favorite podcasts because he gave us a lot of information that you can walk away with, which doesn't happen very often. So he talked a lot about post-concussion syndrome and traumatic brain injuries. One thing that was really interesting is he talked about how this plays a role in our hormones, and how brain injuries actually impact the gut. The difference between, headaches coming from brain injuries or neck issues versus migraine syndrome. So there was just a lot of really useful information. He talked about the labs that you should run if you think this has happened to you. Who you should see to have an assessment to see if you have post-traumatic brain injury. So it's a great episode, and we really hope that you love it the way that we did. Okay, everybody, let's welcome Paul to the show. And, we're so excited about this episode because concussions, post-concussion syndrome, all these brain injuries are completely underestimated in the medical world. So people really don't understand the importance of this. So we cannot wait to dive into this with you. So let's talk about concussions versus post-concussion syndrome. Like, what is the difference?
Yeah, so concussions are obviously an acute injury. So something that happens after you hit your head. There's a ton of research being done about all the different things that are going on after a concussion. So there's an acute phase. I'm sure we'll get into that throughout our conversation, but basically to answer your question, that acute phase normally, it just goes away, Becky, after and resolves within probably about 7 to 14 days. So a lot of times people get symptoms and they'll last for maybe less than a week. And then metabolically, meaning on the inside at the cellular level, usually takes around 20 days to kind of come back to normal. And they don't have any symptoms. You go on, you can go back to learning, you go back to work, you can go back to your sport. But then there is that unlucky 10 to maybe 30%, depending on what research study you look at, that go on into what's called post-concussion syndrome. And that's where you have these chronic symptoms that are ongoing that are present acutely after concussion, but some of them actually can be amplified. I've had lots of patients that they really don't get symptoms until sometimes days or even weeks after their concussion. And then it just continues. And those are the people that I see in my practice.
And what are you looking for when they're say symptoms?
Yeah, so obviously there's a lot of symptoms that are in the world of TBI or concussion, but anything from a headache to neck pain to vision changes, dizziness, ringing in the ears, nausea. There's different mechanisms of action for each one of these particular things, but those are all the kind of acute symptoms. And then they can also continue on into and be chronic, and that is the definition of post-concussion syndrome. And then there's some additional ones too, Becky, where it's like, a person's fatigued all the time. There are menstrual changes that are occurring. There's gut dysfunction. There's other kind of mood disruption that happens. And that's what makes post-concussion syndrome much more difficult to unpack because there's a lot of variables that are occurring.
Yeah, definitely. So how do these two differ from traumatic brain injury or TBI?
They're actually the same thing. So concussion and mild traumatic brain injury are kind of synonymous in the research. And actually there's a third term called sports related concussion that are all actually the same thing. Okay. So if somebody says you have a TBI, there are different stages of TBI. There's mild, moderate, and severe. And usually moderate and severe, there's loss of consciousness. There's something called the Glasgow Coma Scale, where you're going to get tested in the hospital. You're going to be hospitalized. We're talking severe injuries. We're talking, maybe staying in the hospital. Concussions are things that, a person goes usually to the hospital because they might have severe nausea. They might have vomiting. They might even be quote unquote knocked out, or they might have loss of consciousness, but they're able to kind of like come to, they're able to go to the hospital. They're able to walk in, they're able to walk out. A hospital usually does some sort of worst case rule out. So they're going to be ruling out brain bleeds. They're going to be ruling out any sort of severe life-threatening injuries. They'll do a CT scan maybe, and then they usually find nothing if it's a concussion, and then they send them home. So that's kind of what happens, the difference between a moderate and severe, where they might actually find something visually, but concussions, you actually don't have any sort of imaging that will show anything, usually in most cases. A person will be able to walk home, but then that doesn't mean that symptoms are not present. And a person might have a lot of chronicity that happens because you can't actually image anything in post-concussion or mild traumatic brain injury. So don't be thrown off by the definitions. Concussion, sports-related concussion, or MTBI or mild traumatic brain injury, they're all the same thing.
I was rollerblading when I was in high school, and I was with a bunch of people who were much better on the rollerblades than I was, because it was my first time. And we decided to go up and down a very big bridge, and I did not know how to use the stoppers on the rollerblades. So I did a backflip in the air off the sidewalk and landed on my head, and definitely got a concussion. I mean, I was nauseous. I had trouble seeing. It was, but there was no imaging when they took me to the hospital. I mean, they just cleaned me up and sent me home.
Yeah, the awareness, like over the years, I think even the last 5 to 10 years has really grown. It's still way off. The research is always, as you all both know, the research is always way ahead of what's clinical. And so there's a bit of a time lag. Mm-hmm. I still have doctors giving bad advice after concussion. And we'll talk a little bit about what that is, because I still think, concussion is the most common neurological disorder in the world. People don't realize that. These are traumatic injuries. People, when you say neurology and you say a neurological disorder, what do we think of? We usually think of maybe MS, maybe Alzheimer's, right? Yeah. But the majority of the population that affects absolutely everybody, it's concussion, right? It's the most common one. And there's a lot of chronicity that happens with some of these people. Some people resolve, Becky, and some people don't. And that's post-concussion syndrome, unfortunately.
Why do you think it's so, undertreated in women?
Yeah, that's a good question. I think in general, I would say it's undertreated regardless of whether it's male or female. But I would say in women, there's a number of kind of cases that it's even underreported. Generally, a lot of male sports, because concussions are a lot associated with sports, they get a lot of attention. So especially American football, there's a tremendous amount of attention. The concussion movie came out with Will Smith, right? There was a lot of, the lawsuits from ex-NFL players. So there's a lot of awareness there. I think still female sports don't get as much attention as male sports. They get similar funding now, but I still don't think they get the same attention. There definitely is a very strong research, a well-researched idea that women are more susceptible to concussions. Wow. And so there's a number of theories. Right now, there are theories that are the reason for that, Crystal. And so one of them is the neck strength theory, where women have less neck muscles, because I think this is one of the key takeaway points for your listeners. A lot of people are very focused on the head with concussions, but many of the symptoms actually come from the neck. Majority of the symptoms for concussion, like for example, headaches. Right. I work a tremendous amount with chiropractors, functional neurologists, physios, osteopaths, because what I do as a naturopathic doctor, I take care of the metabolic aspect of concussion and post-concussion syndrome. But there is the psychological aspect. There's also the structural aspect. Those three big pedestals have to all be addressed. And majority of providers don't properly assess the neck. They'll say, oh, you have a concussion. Okay, let's put you on some visual rehabilitation, and then totally blows up their symptoms and makes them feel a heck of a lot worse. So neck is a huge issue that's underappreciated, especially, again, for your listeners, the front of the neck. The anterior flexors of the neck, the deep flexors in the cervical spine, everyone's focused on the back usually because it's really tight and painful. But a lot of the symptoms that usually people experience, like frontal headaches, they're going to have a big connection to the big SCM muscle, which is this fat one I'm grabbing right here. And then if you roll off that, there's the scalene muscles, and those are usually like guitar strings for a lot of people. And that's what kind of stops your neck when you go forward. So even if you hit your head, your neck is where you get a lot of the receptors that kind of tell you where you are in space. So you get things like dizziness, vertigo, you get a tremendous amount of visual disturbances that are happening. So women, the theory is they have a weaker neck. So that's one of the theories. There's a hormonal theory as well, Crystal, and that has to do with the menstrual cycle and fluctuations, estrogen being more dominant in the first half of the cycle and progesterone being more dominant in the second half. And depending on when you get hit, for example, some research showing that if you get hit in the second half of the cycle, the decrease in progesterone, which normally should be high, actually predisposes women to have more severe and longer lasting symptoms, which is fascinating.
Wow.
Those are two theories. And there's a couple other ones that have to do kind of more with the dynamics of reporting. Women in general might kind of tell a little bit earlier because they're more kind of predisposed to go to a doctor, where males are like, I'm good, I'm just going to shake it off. And, if you're a clinician, you know that the women have to drag their husbands or boyfriends into the office to get stuff done, right? Same type of thing. So maybe that's why it's a little bit higher, because it's reported more often. So those are, I guess, one of the three main theories why I think women are affected more in the literature.
And we're going to get into a lot of the different, areas that this affects with hormones and gut. But let's say someone has had, they know they've had trauma, whether it's a car accident, sports. Who should they, other than ruling out something extremely serious, right? Like go to the hospital, but like who should they go to?
Well, if you have an acute concussion, for sure, rule out worst case scenarios, brain bleeds, you have bruising behind the eyes, black eyes, obviously things like that, nausea, a massive, most severe headache you've ever had. These are the big things, but the ER is pretty good at ruling that out.
Right.
But after that, that's where it stops. There really isn't any other care. So to answer your question, I think there's two kind of parts. First of all, if you have an acute concussion, or somebody in your family, if you're a mom listening to this and you have kids and they're in sports, they get concussion, after you've ruled out the worst case scenario, at that point, don't rush them back into sports right away. Don't rush them back into a situation where they can get hurt right away. That's number one, because that's where a lot of really dangerous long-term effects can happen if the brain isn't fully healed. I have so many examples that I can think of where a patient hit their head, they had some symptoms but it resolved, but then they unfortunately hit their head again. And sometimes it might be on like a cupboard or a door frame or something like that, or a car door. And that's where all of a sudden they're into PCS after that. So it's kind of like that second impact syndrome. There actually is a law in Canada where I'm from called the Rowan's Law, where, there was a girl in high school playing rugby and got a concussion and didn't get properly managed, got put back into playing, and then died because she got another concussion. And that's something in the literature called second impact syndrome. And so there is legislation now putting in place that there's more safeguards of making sure that doesn't happen, sitting people out. So that's the first thing. Don't re-injure yourself too early. Just because your symptoms are gone doesn't mean that your brain is healed on a metabolic level. The physiological healing lags behind the symptomatic healing. So just because you're like, I'm feeling fine, and it's been 48 hours after a concussion, you got a big game coming up, if you have a doctor that's assessed you and says that you've had a concussion, you definitely need to wait, I would say, at least a week. And the research shows 2 weeks to be fully metabolically back to normal. And so, secondly, for an acute person, definitely get assessed by somebody other than a family doctor or primary care provider that just says, yep, I think you got a concussion. They might look at you and then just send you home. There are no medications, unfortunately, that have been studied to treat concussion or have any sort of neuroprotective effect. They are all symptomatic. So what I mean by that, that means that Tylenol or Advil that's prescribed for pain, that is not doing anything to help heal the brain in any way, shape, or form. It's helping you maybe feel a little bit better. And so I think the best first step is to have some sort of assessment by a physio or a chiropractor, not necessarily treat you, but just get assessed to get a baseline. And I call them TBI literate providers, because not everybody is TBI literate.
Yeah.
But there is a growing group of people. I'm part of a group, which you probably said in my bio, called Complete Concussion Management. And our mission is to train as many providers in being concussion literate, because we just realized that there is not that much awareness. What do you do in a situation like this? So they would test your exercise capacity, because one of the most important ways of determining if you're ready to go back to action and back to sports and schooling or whatever activity is to test your autonomic nervous system. And how do you do that? Well, we get you on a treadmill and track your heart rate and see if you get symptoms. So if you can max out your heart rate and do, let's say an exercise, and in this case, you get on a treadmill and you don't elicit symptoms, then you're probably metabolically recovered. A person might be non-symptomatic, but you get them on a treadmill and all of a sudden their heart rate gets to 120 beats per minute and all their symptoms come back. That's a sign that you're not recovered. So there's a way of double checking and testing if you're able to return back to action. Even though at rest you have no symptoms, it doesn't matter. You got to be able to function at your sport or your activity level.
That's the Blackhawk. Is that the Blackhawks?
Yeah, that's the Blackhawks protocol. So that was Dr. John Letty from Buffalo. And also he worked with Chicago Blackhawks and they basically came up with this protocol.
Okay.
And then just the last thing I would say to answer your question fully would be, if you've had a concussion in the past, and this is more applicable to more of your listeners. If you've had a concussion in the past, what would you do now and to assess it? Well, if you still think that you've have nagging symptoms, or then you probably need to do the same thing, get assessed by a concussion literate provider. And usually we start with a manual provider. People come see someone like myself when they suspect some sort of endocrine disruption. So for example, they're like, you know what, ever since I've got a concussion, my hormones have been totally off. My IBS has been massively flared up. I'm so tired. I'm so fatigued after my concussion. So if there's those types of symptoms, then that's a big indicator that we have to assess your hormones. We have to assess your metabolism and then treat that. But generally, start with the manual concussion literate provider.
Okay. Can you go into a little bit more about the hormones? Like, how do concussions impact the hormones?
Yeah, that's a great question. One that's often overlooked. And, I recently just had a sports doctor refer a patient over to assess someone's hormones, because they suspected it because they were really tired and their menstrual cycle was off. But that's really rare. So a lot of the awareness isn't great. But the research, as I said, remember, is always way ahead of the clinic. But the research does show that hormonal changes can happen right away after a concussion. After a simple, mild traumatic brain injury, you have three main hormones that change. Number one, prolactin levels. I don't know if you ladies have talked about prolactin on your podcast before, but prolactin is a hormone that can disrupt your whole entire hormonal axes, and it can definitely disrupt menstruation, disrupt fertility. It goes up.
Yeah.
And that's related to more of a neuroinflammatory situation that's happening. Then you have DHEA and cortisol that go down a little bit. So that's your stress, one of your major stress hormones. And then you're going to have your progesterone that goes down. Progesterone, as I already mentioned, is a really key neuroprotective hormone. A lot of times we think of and pigeonhole hormones into they are for reproduction, they are for menstrual cycle, they're for libido, but they're also really important for many other protective effects in the body. Ask any menopausal woman and they'll say that, they get brain fog, for example. That's because estrogen is really protective for that. So hormones can make a big influence on a lot of symptoms that people have in post-concussion. Now, I will say that just like people's symptoms like headaches, dizziness, vertigo, those kind of things, they will resolve in an uncomplicated, mild traumatic brain injury or concussion. Hormones go back to normal in those uncomplicated cases. But if you are, again, in that 10 to 30% that go on into post-concussion and post-whiplash syndrome, then you can actually have these dysfunctions on the hormonal level continue. And now at this point, this is where it gets interesting, because the research shows that up to a year to even 5 years later, you can have hormonal deficiencies that start showing up.
Wow.
And the reason for that is because the master hormone gland in the brain is the pituitary gland, as you both know, and that is in the brain. That can be disrupted from a blood flow or from an oxidative stress perspective. It can be disrupted slowly over time. And that effect, because the body has a lot of compensation mechanisms, that effect is not seen and felt in terms of actual end organ deficiencies, like, for example, the thyroid or the adrenal system, for maybe months or even years later.
Wow.
So what I do with my patients is we test all those hormones. And then at that point, it can be any of the hormones that come out of the anterior pituitary gland. So for example, one of the most common ones is growth hormone. Mm-hmm. Growth hormone is really not often tested. It's one of the most common deficiencies that occurs. TSH, or thyroid stimulating hormone, is another huge one. We know how important thyroid is. Yeah. I find a huge one in my practice that, again, is really poorly understood in conventional medicine is going to be the ACTH, or the adrenal corticostimulating hormone. And the adrenals, we know how important that is for regulating blood sugar, regulating mood, regulating inflammation. And so those are huge areas. And then finally, of course, LH and FSH, which are the key menstrual regulating hormones. So those are the kind of 5-6 main hormones. They can be disrupted right away. They can return back to normal, or they can continue to be dysfunctional, and they can slowly be brewing under the surface in post-concussion syndrome for a long time, Becky.
I have a question. So you know how you'll see sometimes TSH will be low, but also T3 and T4 will be low. So you know that's like a pituitary suppression pattern. So would you think then maybe they've had some past, or, this is like a post-concussion syndrome type of situation?
That's like really intuitive of you to pick up, because that's a really common pattern that I see, where it's like, it's not a usual pattern. So if I see a low TSH and then also low T3, T4, it's like, I always ask them, did you hit your head in the past? And then they'll say, actually, yeah, I slipped and fell on the ice last year. And, I've been kind of off since then, but I never really thought about that. So yeah, it's funny how you say that. That's a really, 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 really good observation.
Yeah. Can you talk a little bit about the metabolic component with head injuries?
Yeah. So obviously we talked about the hormones, and that's a huge component. And I consider metabolic, hormones, obviously. Yeah. But I think it's definitely, I'm glad you asked that. There's definitely a huge inflammatory component. There's also a huge autonomic component when you look at metabolics. So let's talk about just what happens in the brain after a concussion right away. And that's going to obviously going to continue in post-concussion. So first of all, you hit your head immediately. There is a stretching of your nerves in the head. There also can be a trauma as your brain kind of bounces around. There's that typical coup, counter coup, where, you hit the front of your head, but there is also an inflammatory pattern that happens immediately. None of this can be visualized. You can't take a CT scan or an MRI to see any of this. And there's obviously blood flow changes that happen right away. So, if there's any sort of trauma, inflammation, blood flow is going to be minimized and limited. So first thing that happens is that you get a stimulation of these little cells in your brain called microglia. These microglia are inflammatory cells that are unique to the central nervous system. They're really easy to turn on. They're kind of like guards. They're similar to what you'd find in the rest of your body, like macrophages, and they protect you from different things like infections. But in the brain, they are going to be turned on, and then they start spitting out lots of inflammation. So an injury can turn them on, and they are now causing a local inflammatory effect. And immediately also at the same time, you have an excitotoxic kind of what's called a cascade. Everyone's heard of MSG before, and everyone knows that MSG is not good to eat. That's monosodium glutamate. And so there is these neurotransmitters in the brain called glutamate, is one of the main ones. And there's kynuric acid. There's a number of other ones as well, quinolinic acid. And if you have an excessive amount of these, which happens stimulated right away after a concussion, you start getting this excitotoxicity. That's a term that's in the research. And finally, so you have inflammation, excitotoxicity, oxidative stress, as I mentioned, and then finally you have something called basically a mitochondrial dysfunction that happens, where you have this injury and the brain is trying to keep itself in homeostasis. And so normally you have lots of magnesium and potassium inside your cells, in your neurons, and you have calcium and sodium outside. but that gradient gets totally shifted, and all of a sudden the brain tries to maintain that gradient via ATP. You need to have these, I know we're getting into biochemistry here, but you need to maintain the ATP gradient in your neurons. And after they become damaged with the stretching and the excitotoxicity, that basically the mitochondria are immediately within a couple hours tapped out. And that's why a person feels so tired. They're going to get a headache right away. And you have a very kind of hypofunction in the mitochondria, which slowly after, and again, in non-complicated concussions, it kind of recovers and it gets back to normal. But again, in post-concussion syndrome, you're going to have a longer-term mitochondrial energy ATP deficit. And so you have this kind of like trifecta of things that are happening in the brain immediately. And then long-term, you basically have microglia that can be turned on and they don't really go back to their latent state. And that's where you have, I eat anything that is sensitive and it flares up my symptoms. Any sort of immunological trigger is going to be a flare. A big one is infections too. So that's a big immunological trigger. I have had many patients that, get a vaccination, for example, and they have a huge trigger. And again, it's an immunological stimulant, right? They might get COVID itself and they get symptoms flaring up. So these are all key signs that the microglia are still very primed and they're ready to produce a ton of inflammation.
Yeah. And I see a lot of mental fatigue versus physical fatigue, right? So that just makes so much sense.
Yeah. And that's exactly where you're getting the mitochondria and the nervous system not able to maintain their function, maintain their gradient. And then obviously all the decompensation that occurs, all the, the structural issues that are, the brain has to work extra hard. A lot of times also a huge area that I see is this what's called dysautonomia. And I don't know if the listeners have heard of that before, but basically it's a dysregulated automatic or autonomic nervous system. So this is all the functions that you don't even think about that are happening. Like, for example, your heart rate. You're going to have breathing that's going to be affected. You're going to have the tightening or the relaxation of your blood vessels that are happening. And that changes if you change posture, but all of a sudden getting up is a big challenge to people, or walking around the block is a big challenge to people because their autonomic nervous system is stuck in this fight or flight mode. And it's always in high sympathetic mode. It's always trying to deal with a stressor because it's overwhelmed, too much input. You have cortisol and adrenaline and epinephrine working on it as well from a stress hormone response. And then a lot of people are just not able to be functional because their autonomic nervous system and their blood flow to certain areas of their neck and brain are impaired. So that's a huge area that also occurs and can continue to occur in post-concussion syndrome.
Yeah. What about how the brain injuries can impact the gut? People are talking a lot about the vagus nerve, but I don't think not everyone really understands that.
Yeah. So just a quick review for everybody. Obviously, we've heard of the vagus nerve and the gut brain connection. So there's this main nerve called the vagus nerve that connects the central nervous system to all the organs in the abdominal and the thoracic cavity. So heart, even the diaphragm, which is your main muscle, which is why deep breathing is so helpful, is because it helps regulate the autonomic nervous system via movement of the diaphragm. The stomach, intestines, all of it's regulated by the vagus nerve. Now, after concussion, this is fascinating. After concussion, within 3 hours, Becky, you are going to get an increase in permeability of your intestinal lining. And the idea behind this is that, and this is the theory, is that the brain and the body are very intelligent. They want to start recruiting inflammatory cells to heal the body. And so you're going to temporarily have an increase in permeability. Now, the problem is that what if a person already has some issues before that are just now further magnified? Like, for example, they might have inflammation happening. They might have food sensitivity. They might have IBS and dysbiosis. So I always say, a concussion, just like any other trauma, is a trigger. And sometimes it triggers an underlying metabolic weakness to really come forward. And in some people, this can be the gut connection. So a lot of people are like, my peristalsis and my gut bowel movements are totally off ever since I've had a concussion. That's because this connection is no longer working the way it should. Also, there's a huge connection with cortisol. If you have tons of cortisol, you have more permeability in the lining of the membrane. You're not absorbing your amino acids as well, which are important for production of neurotransmitters. You can see just like how this just snowballs,
domino
right?
effect. Yeah.
A massive domino effect. So that, again, is short-term. It can be regulated and it goes back to normal. However, in PCS, it often doesn't. And that's now you can get this dysregulated gut-brain connection, and you can have another source of just chronic inflammation, Becky. And so there is definitely in the literature a strong connection between traumatic brain injury and getting intestinal hyperpermeability happening right away.
It's so amazing, like the connection. It's unreal.
Fascinating, right?
Mm-hmm.
And so then the question is obviously, what do you do with that? How do you treat it? So obviously, one of the ways of regulating inflammation is trying to break the cycle somewhere. How do you break the cycle? Well, let's maybe try to do it at the level of the gut. So maybe we'll stop the permeability, we'll fuel the gut lining, we'll make sure the microbiome is optimal. And that will also turn off the tap of inflammation for the rest of your body, for the brain. So you can tackle it that way. You can also tackle it through using diet and specific nutrients to try to calm the microglia. So the microglia are responsive to cells like mast cells, which again are stimulated by allergy. So eliminating food sensitivities, identifying them, eliminating anything that's going to be further triggering. So I find gluten is a massive neurological trigger. Probably the lowest hanging fruit that a person can do is cut out gluten 100%. I have this analogy with my patients that if you cut out gluten 50% of the time, you get 20% of the benefit. But if you cut it out 100% of the time, you get 100% of the benefit. It's one of these kind of really exponential curves that happen. But I used to, at the beginning of my practice, my friends used to call me everything in moderation man. But I realized that just didn't work with gluten.
Yeah, it does, especially with gluten.
Yeah, you need to all be 100%. And that has to do with, again, the immune system has a memory for at least probably 3 months, I would say, clinically. And usually people notice the difference within a couple of weeks or even a couple of days if you're very sensitive. But immunologically, you have a memory. So if you just eat, people are like, I don't eat gluten. And then I ask them and they're like, well, I have pasta once a week, or I'll have that croissant a week. I'm like, well, you're just re-triggering that immune system just to keep reacting to it. So you need to really give yourself a good month to really try to avoid it, and then notice, is it going to have a beneficial effect? And usually people, if it is, they're going to notice it pretty quick.
Yeah. And sometimes it's like gluten needs to be taken out and something else, because it's just one piece of a puzzle. And it doesn't mean you don't stop eating gluten because it didn't solve all your problems,
Right.
No, you're trying to break the cycle somewhere. So you're trying to reduce inflammation at, the immunological level. And there are usually multiple food sensitivities. That's one. Sometimes you can become more sensitive after a trauma, like a concussion, to different foods. That's again, because the immune system's on high alert. So you can't just cut out foods and solve the problem. You also have to look at cortisol levels. You have to also look at adrenaline. You have to look at autonomics, because all these things, including the vagus nerve, are going to help regulate how reactive a person is to certain molecules, immunological molecules like food proteins. Because again, I'm a big picture perspective. I'm not one of these providers that's like, yeah, you got to be gluten-free for the rest of your life if you are not celiac. I genuinely want a person to get back to eating a more complete diet. Now, there are definitely unhealthy versions of every one of these foods, but in principle, I don't think that there's any whole food that's unhealthy. You just might have an immunological trigger to that. And you may not be ready to bring it back in, but maybe at some point you will, or you might be able to tolerate it minimally. But that's, again, down the line. And it's more of just my philosophy of, if you eliminate all dairy, all eggs, all gluten, all soy, all nuts and seeds, all the things that I see all the time on food sensitivities, you'll end up eating a very limited amount of foods. And lettuce and chicken, pretty much lettuce, chicken, and rice, and you'll be miserable, and your body will eventually become sensitive to that. So that's not like a long-term strategy. What are we going to do to help rehabilitate the microbiome so you're not as sensitive to things, right?
For sure. Can you go in a little, because we get a lot of questions about headaches. So can you talk a little bit more about those?
Sure. Yeah. So I think we have to distinguish because I also work in a lot with chronic pain. So my kind of focus is obviously concussions, but which headaches is a huge component of, but also chronic pain, which is sometimes independent of getting a concussion. So obviously you have to determine, do you have migraines or headaches? There's two things you have to kind of look at. Once that's been ruled out, migraines have a very different clinical presentation. So you're going to treat that differently. There's different mechanisms of action. But if we're going to focus on headaches specifically, we're going to look at, first and foremost, majority of headaches, I would say in my experience, 90% have some sort of structural reason why that's happening.
Yeah.
And when I say structural, I don't always necessarily mean your neck, bones. So or your neck facets. My brother's a chiropractor. I work with a lot of chiropractors. So I know that, the subluxation theory of chiropractic wants to say, you just manip the neck and all's good.
Yeah.
You have to look at the soft tissues. You have to look at the ligaments. I find probably the most underappreciated part is the myofascial component, or what we call cervicogenic reasons for headaches. And there's a couple ways you can know this is the case. First of all, these types of headaches, they're the most common ones. They're, worse after using screens, worse after being at a long day at work, worse after visual strain, worse after exercise, worse after sleeping wrong, and kind of either tweaking a facet joint that's a bit more inflamed, or a tight neck muscle. And this is very common after a concussion. You don't actually hit your neck, you are going to strain it. You're going to have the muscles that are going to strain. And so if you've ever been treated and all your symptoms got worse, that's like a ding, 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 red bell sign that you have to look at that area. And a lot of people get really scared because they're like, I don't ever want to, feel that aggravation again. A really common one is if they did acupuncture and all their symptoms came flying back and they were really, it was really problematic. That's just a sign that that's a really problematic area that needs to be maybe more gently addressed. So that's one sign that you really need to look at. If you haven't had as I mentioned before, your front, side, back, your facial at TMJ, your facial muscles, your jaw muscles, if you haven't had them fully and 100% joint and muscularly assessed, then we have to assume that that's part of the problem. And any sort of common tension, post-concussion headache, when you have things like cluster headaches and migraines, those are a little bit different, and there's different mechanisms to be had for that. Still, all the structural stuff should be assessed, but those are unique differently.
Absolutely. And with migraines, I mean, those can come from hormonal inflammation.
100%.
I mean, it's
a huge food component, right?
Yeah.
So you have to approach those a bit differently. Usually tension headaches might be made a bit worse, let's say around your period, or it depends on the food that you eat. But usually there's a very clear kind of major trigger where, these, especially after concussion, these tension type headaches, they're just like, I feel like it's there all the time. Another key sign might be, does it get better with Advil? If you take an NSAID medication, migraines don't really usually respond to NSAIDs in any way, shape, or form. Or maybe the edge off, you have to use like the triptan medications or some other stronger medication. If your Advil actually does work, that's a big indicator that it's inflammatory in some way, and it's probably myofascial in some way.
Yeah.
So I would double down on assessing and treating those areas rather than worrying about, is it a migraine? It's important the way we think and talk about certain conditions, because it really, helps us not live in denial and get us the right treatment for certain things. And it helps your providers treat you better. Like for example, a perfect example would be a concussion patient, a person that sustained a concussion, and a person that has post-concussion syndrome. They keep saying, the concussion, I got to treat my brain. But now you have to treat your hormones and your neck. And you no longer should be considering yourself a concussion patient. You need to now address the underlying issue that is the problem. So that is more fruitful to think about your condition in those terms rather than thinking about them as, I'm a concussion patient. That was the initial trigger for you, but what is the real reason why you're getting that? Let's talk specifics and be a little bit more precise. I have cervicogenic myofascial pain that's causing my headaches, and the original trigger was a concussion. That would be a more accurate way of speaking about it, rather than saying, no, I'm a concussion patient and post-concussion. I think that really throws a lot of, especially conventional providers, off, because there's really no treatment for post-concussion.
Right. Yeah. Zero. Do you find too, like I know that we're going to get this question a lot too, and people who start thinking about their life, like, okay, I got in a car accident, or I had all these sports injuries. So some patient will be like, am I doomed? Right? Is there some, am I never going to get better? Or can you just touch a little bit on that?
Sure. Yeah. Listen, we can't control what happened in the past. I've had lots of patients that are like, I had 10 concussions when I was playing hockey or football. All you can do is optimize your health right now. So the best thing that a person can do is, okay, so I'm going to try to be as anti-inflammatory with the way I live, the way I move, the way I eat, the way I sleep. That's the best thing you can do. A lot of people get freaked out because they see this chronic traumatic encephalopathy, CTE, which was really, again, amplified by all this NFL stuff in that movie, where they were like, my brain's going to shrink. I'm going to get Alzheimer's or something like that. There's no strong connection in the research, despite what a lot of media says, that concussions cause CTE. There's a tremendous amount of other factors that that can cause that connection. For example, prescription drug use. There's an excessive amount of abuse of that happens in pro football players, and which is where a lot of this stuff comes from. There's a lot of depression. There's a lot of poor diet that happens after they're finished playing. So there's multiple factors to this. So just because you've had concussions does not mean that you are damned with neurological health for the rest of your life.
Yeah.
So that's my takeaway with my patients. But I will say that it's kind of like, if you just sprained your ankle 10 times playing sports, you're probably going to have pain in that ankle from an osteoarthritis perspective. So the same type of principle, I think, also is applicable to your brain, because every time you have a concussion where, you might have been, quote unquote, bell rung or knocked out multiple times, that does have some inflammatory changes that happen in the brain. And so we know that there is an inflammatory component to some neurodegenerative condition. So I would consider that as a potential risk factor, in the same way that I would consider past joint injuries a risk factor for osteoarthritis, if we can maybe use that analogy. Mm-hmm. So I still think that person might be really proactive with their manual care, be really proactive with their supplements that they can use to help reduce inflammation. For example, turmeric is a great one. And there's a tremendous amount of preclinical research, which is still not in humans. It's not awesome, but it's decent to start to say that, yeah, you know what, it might reduce some of these neurofibrillary tangles and tau protein dysfunction, et cetera.
Mm-hmm, mm-hmm. And magnesium too, right? Quercetin, good.
Magnesium, quercetin. There's a ton that go down. N-acetylcysteine has been consistently researched.
Yeah.
Creatine post-concussion for mitochondrial function, omega-3s. We can't miss those.
I know. We could go on forever, right?
Yeah. I mean, I can just keep rhyming them off. Like, all these have some evidence. The knock always is that, show me the large RCT showing me the benefit of this. And that is just simply really hard to study concussion patients. There's different ages. There's, it's just a bit of a quagmire to try to study this on a large scale setting.
So from a functional medicine if a patient or a listener is listening and they're like, okay, I know I've had some form of head injuries, like what type of testing, like if they're starting to think, what type of assessment do I need? Where can I start as far as functional medicine? Yeah.
So I'm always a big proponent of using your body's symptoms to guide assessments. Mm-hmm. So just going to a neurological clinic and saying, I need a SPECT scan because I got to check my brain because I saw that online and, different, imaging. I don't think that necessarily is fruitful, because you could have a visual dysfunction somewhere on imaging that doesn't necessarily have to correlate with symptoms. So start with your symptoms. So if you have a concussion in the past, but you're feeling great, you've had no residual issues, then probably safe to say you're in the clear. You can maybe be proactive. But if you maybe still feel a little off, you've had some symptoms that are not resolving, then start with the manual assessment. And then maybe with your functional medicine doctor, maybe start looking at some areas like hormones. A complete blood workup's the easiest place to start. Include thyroid, include things like prolactin. You can just check estrogen, progesterone, LH, FSH, especially if you have hormonal dysfunction, if you're female and menstrual issues, if you've had a history of things like PCOS, or you're trying to get pregnant. All these things would make me think I need to assess the hormonal area. Then I really am also an advocate of saliva and urinary hormone testing. Again, if it's applicable. So I'll use the Dutch testing, for example, is a really common one that I really like. And again, these are now higher ticket items for patients. And so there's a bit of investment. You need to work with somebody that's going to interpret that and then also treat based on that. Not just like, hey, I'm just going to get all this testing, but what am I going to do with it? Right?
Yeah, people always do that. They're like, where can we get the Dutch test? I'm like, from someone who knows how to read it.
Yeah.
And
I mean, exactly.
You,
so there's no point just ordering it and then you have it and then you're like, what do I do with it? Like, I mean, a lot of what I do is interpret this stuff with patients because they've got it done somewhere else. So they even got it done with other providers, and the other provider doesn't really know how to assist in the context of a concussion or context of general endocrine stuff. So that's a really a good place to start. And that would, at least on the metabolic front, give you a really good idea about hormones. The last thing I'll say is about inflammation. It's really hard to test that. There's no real good way of testing hormones to test inflammation like there is for hormones. Because something like CRP levels, they're just really not going to show up as being off if you have neurogenic inflammation. They just won't. They'll show up in autoimmune conditions, which is good to rule out if you suspect you have some major autoimmunity issues. But otherwise, nothing else is going to show up other than like, vitamin D and B12 and iron deficiencies, which are really common, but those usually run out.
Right? Do you think homocysteine is a decent marker for brain health?
I think it's a decent marker of telling you if you're deficient in methylating factors and glutathione. That would probably be the best thing to say. To say, is it good measurement of brain health? That might be a bit of a stretch.
Yeah. I mean, just like with everything else. I mean, I think putting a homocysteine.
I would include it. Yeah. Yeah, totally.
Yeah. Okay. Well, this has been so great. Amazing. We love episodes where there's takeaway, useful information, and you've really done so much with that. So thank you so much. Can you tell everybody where they can find you?
Yeah, in my website, I'm sure you'll have it in the show notes link, paulhrkalnd.com, or my Instagram page is a great place to reach out to me. You can find me at Dr. Paul Hrkal. There's lots of resources there, great interviews that I've done with tons of top people. And so, I think that if you've had a concussion, there is a solution out there for you. It may be just haven't had the right care, and look for a TBI literate provider. I think that's probably the best way. And then finally, if you've had a concussion and you're struggling with that right now and you're listening to this, one of the big passions that I have is I want to, not everyone can see me. I'm one person, and we're training other doctors, but we also wanted to make a lot of this knowledge and care on those three principles, the metabolic, the structural, and the mental, psychological, available to everybody. And so we created a program called Concussion Fix. And so you can go to Concussion Doc, D-O-C, concussiondoc.io, and access this program. It's available from anywhere in the world. It basically teaches you module by module about diet, about the hormones, about the vagus nerve. And then that's my component. I also worked with a psychotherapist, and they've dealt with the psychological aspect of things. And then we have Dr. Cam Marshall, who is a concussion-focused chiropractor, one of the leaders in North America, and he's created the manual side of things about exercise and what's going on in the brain and physiology. So that's a great place to start. I wish all my patients that come see me did that program before, because it's like a great baseline. And then we can actually get into what that personal issues that they might be having. That's an amazing place to start. And then, we've been collecting research on that, and we know that people that take the program have a huge improvement just by doing this program, which you can do it at your own pace and the comfort of your own home. So that was one of our missions, and I was really glad that we kind of got that out over the last 2 years.
That program sounds amazing.
Yeah,
it really does. Great. We'll link to that for sure in the show notes.
Awesome. Thank you. Thanks for having me. I appreciate it.
Yes, thanks for coming on.
And you're really amazing. So thank you so much. And thank you everybody for listening. We hope you have a great day.
Thanks everyone. Take care.